My name is Terry Manville, and I live in Bay Village, Ohio. I have rheumatoid arthritis. I started showing symptoms at age 16, and I'm now 60. I led a full and active life. I was an athlete and an active working woman up until about 15 years ago, and following the loss of my COBRA coverage, I was unable to get health care that was affordable, or even in many cases find health care that would cover me because of my pre-existing condition with rheumatoid arthritis. I had to fund all of my own medical care and my prescriptions, some of which were several $100s a month. These hands are one of the consequences of that. I was unable to afford the cost of biologics which were available, which have been proven to significantly stop joint deterioration. They cost anywhere from $13,000 to $15,000 a year or more. So it was a question of, do I pay my mortgage and buy groceries, or do I spend money on medicines that I can't afford? This is what has occurred, and it's had a greater impact than just a financial impact on my life. It slowed my life down. It forced me to go on Social Security disability, and I'm thankful that I have Medicare coverage, but even so, last year I spent more than $6,300 out of pocket on health care. I think it's imperative that they look at some sort of health insurance for everyone where we do have to pay something. I'm willing to pay something, but we need better coverage than we have now. If we have a healthy country, just think of what we can do, not only in America, but around the world.
My name is Xander. I'm 23. I'm a waiter. I work part-time because my hours have been cut back and restaurant business is slowing down. Can't make as much money as I used to. I live in Rocky River. I rent a room from my roommate who owns the house. I've been living without health insurance for about 2 years now, and it's an everyday worry. It's an everyday worry that something might happen and I can't go to work. Either I'm in a car wreck, or I get sick, or something happens at work and I can't work. It's just the constant fear of something happening. And if I had health insurance, it would alleviate that mental block that I have of just not having to worry about it all the time. About a month ago, I was just going about my business, and I stepped on a large piece of glass and cut right through the bottom of my foot, right on the ball of my foot. And it bled for about a good 2 or 3 hours, and I called friends, and they all said, "You may need stitches. Go to the emergency room." I said, "No way. I don't have health insurance." "Oh, well, they have to take you." Well, they can take you, but how much debt would that put me in? There's no way I could afford any medical bills, no way. So I just cleaned it up, put some Neosporin on it, wrapped it up, and hobbled for a couple of days until I got better.
And you're a resident in the west side of Cleveland?
Yes, I live in Brooklyn. I have asthma, I have post-polio syndrome. I've had 3 TIAs, which are mini strokes, and I'm trying to think, I've been in the hospital so many times in the last year. And then I had something called cellulitis in both legs, and that kept me off my feet for quite a while. So it's just a multitude of things, and it all stems from being a diabetic. And the insulin I take is really expensive. It's not the ordinary insulin. If I had to buy it in a drugstore, it would be something like $60 or $70 a bottle, and I pay just a fraction of that at Metro. Otherwise, like I said, I'd be dead because I couldn't afford anything like that. So, even though I get a good rate at Metro, it's having to go there and having to sit in the clinics and wait. And they've gotten better over the years, but it's and I've noticed with the economy now, there's so many more people there, so you're waiting a lot longer. So it's not like going to your family doctor. I mean, you worry every day if something's going to happen and you're going to have to be off of work again. Are you going to be able to afford anything? You know, you have rent to pay and utilities, and so you try and very hard to stay as healthy as you can, but it doesn't always happen that way.
When the sun comes shining, then I was strolling, and the wheat fields waving, the dust clouds rolling, the voice coming chanting, and the fog was lifting. This land was made for you and me.